Hello, everybody, and thank you for taking some time out of your busy days to join us today. I hope that our presentation is going to find everybody well and be beneficial to all of you. My name is Tony Peterson. I am the Director of VAR Sales at Next Trust, and I will be presenting today's presentation. With me on the phone today, we have James Easley, Mari Sarmiento, and Richard Davis, who will all be assisting with different things throughout the presentation. So without wasting any time, let's jump right into the presentation and talk about how we can together help maintain patient care, billing, and payments during uncertain times. And really, we want to focus today on how the combination of telemedicine, online patient billing and payments, and other tools can help you and your patients as we go through this uncertain world with the social distancing and mandatory lockdowns and stay-at-home orders that everybody is working with right now. Our real goal with this webinar is to help you and your practices see how you can continue to function and operate, and give you some good information on best practices for doing so as we enter into these weeks and months, who knows how long of separation that's being put on us. So I wanted to kick this off. Let's see if I can get this to work. With a quick story. This is my third son, Tucker. I have 4 boys. This is my third son, and he has a number of different reasons that he visits with his doctor, his pediatrician, on a quarterly basis. He has some medications that need to be refilled. He usually is in there at least once every 3 months, visiting with his primary care provider. Well, we live in the Atlanta area. In our area, everything has been shutting down and locking down like most other parts of the country. And one of his visits occurred just a week and a half ago, after the lockdown had started. Well, Tucker, he needed to have this visit because he had medications that he needed a refill for that he couldn't get without having the visit. But the doctors were not able to have him come into the practice due to some of the rules and regulations that have been put in place in our area right now. He had to stay at home. So in order for Tucker to really be able to get the health care that he needed, we ended up logging on to the website for our primary care, or not our primary care, our pediatrician. And we had to make a payment, a co-payment for a telehealth visit. And then Tucker spent the next 20 minutes talking over Skype with his pediatrician about his conditions, and the physician did his evaluation over Skype and was able to then electronically prescribe his medications, and they were waiting for us at the pharmacy, where we were able to go drive up through the drive-through and pick those up without ever having to get out of the car. It was a really great experience for us to realize that the care that Tucker received was still able to continue, even though we and all of those in our area, including our pediatrician, are practicing social distancing in order to help combat what's going on in the world right now with COVID-19. So we want to talk today about different ways that you and your practices can utilize telemedicine combined with some of the services that the Bill Flash has to offer to continue to function and to continue to see revenue come into your practices while you are working from home, or like our pediatrician actually saw Tucker from his home. It was a really interesting visit. So let's go ahead and get started. We'll go through an overview of what we're going to be talking about. This COVID-19 situation is impacting almost all facets of society. What we're going to focus on today is the impact that it's having on both patient care, billing, and then the payments that are coming in. Because as a practice, if you don't have payments coming in, it's really hard to function and continue to offer the services that you do because everybody needs to continue to earn their living and provide for their families. So we're going to start out talking about some of the different telehealth options that are there. When we talk about telehealth options, we want to make sure that we understand that we're talking about ways that you can utilize multiple different technology platforms in order to provide the services that are there. We're for today's webinar, not going to focus on any one individual solution for telehealth, but talk to you about different options that you have and give you some things to think about as you're working with your resellers to determine what might be best for you. We want to make sure that we understand how we can help you simplify the billing and payments for the telehealth options that are there by allowing you to do multiple things like remotely sending mailed and eBill patient statements. You don't have to go to the post office and have more interactions with people. We will be able to show you how you can offer online payments to promote social distancing. And with most of your software packages, then you'll see that those payments can load right back into the practice management system. And I'm going to pause the presentation for 1 second and just ask if one of my coworkers can go take a look at what's going on with the webinar. It's saying that it is full. We may have to offer this again, but if one of you could go either figure out how to get those people on or let them know how they can have another webinar after this, would be great. But I'm going to continue through the presentation for those of you who are on. So the last thing that we'll cover is how to set up things like payment plans to help make payments more manageable for your patients who might be affected by the economic impact of the coronavirus. So let's go into a poll real quick just to see those of you who are on the call, what is your current telehealth use? So with that, James, would you be able to put up the poll for telehealth? So is that up? Let's see. If you look on your screen, there are multiple different options that are there. You can say we've been providing telehealth visits for a while, we just started to, or we're looking for telehealth systems. There's a couple of people that are saying they're unsure of how to start a telehealth visit, and a few of you that are saying you have no plans to offer telehealth visits. So regardless of what your situation is, if you answer the poll that is up there, that'll help us know how we can best help you and help you understand what options are there. It appears that the majority of you are either brand new to telehealth, looking for telehealth, or unsure of what you need to do in order to get started on that. There's a few of you who've been doing it for a while. It looks like about 5% of you. So we'll close that poll down and say that most of you are either brand new or looking to be new in the telehealth world. So but I think that there will be some really good information here for you as we go forward. So what do you need to know about telehealth? The rules and regulations around telehealth vary. That should probably say do vary from payer to payer. It means that Medicare has their own rules, Aetna has their own rules, Cigna has their own rules. We'll talk a lot about those different rules that are there, some of them that we can go into in depth, but it's very important that you stay in contact with all of the payers that your patients are utilizing to pay for care in your office or in your practice, in order to make sure that you're providing the highest level of care that you're able to, but also able to ensure that you receive the highest level of reimbursement that is available to you for the telehealth visits that are there. It's also very important that you understand that there will have been some previous regulations from Medicare and CMS regarding how and when telehealth is offered to practices and patients. And there's also HIPAA regulations that have been relaxed during the current national emergency. And we'll be able to share a lot of that information with you and share with you links that can get you to even more information if you need to find out more after the webinar is completed. Even if you are able to see your patients right now, you need to ask yourselves if you're able to bill them and get paid for the visit. In Bill Flash, our tagline is getting you paid. And what we see with most of our clients is that the majority of the payments that they receive from patients are in-office payments where the patients make as they're standing there in the waiting room waiting for their visits to occur. Well, if patients aren't able to go to your visits or to the visit in person and they're not there in the waiting room, it's sort of hard to get them to swipe a credit card. So that means that you really need to have options to collect that from patients remotely, allowing them to continue to practice social distancing, stay in their homes, and still have that revenue flowing to your practice. Another really important thing that you need to ask yourself is how the telemedicine platform works with your EHR or practice management system. There are numerous different telehealth platforms out there. They're all experiencing an extremely high amount of volume and people asking for information and help. But as you're making a decision on which system to use, you want to make a decision that will be good for your practice in the long term. So as you're evaluating the different options that are out there, make sure that you're asking yourself how it works with your electronic health record or practice management system. Another very important thing that you need to understand is that while the Medicare and HIPAA regulations regarding the visits have been relaxed, PCI compliance, which governs how you process credit cards, and the rules for processing credit cards is not suspended during the current crisis. So that means that you need to make sure that you're able to process your patient's credit cards in a PCI compliant manner. So let's take a look at Medicare real quick and help you understand that telehealth is not just a Skype visit that you see with your patients. There's 3 different types of telehealth care that are reimbursable by Medicare. Each of them have different requirements, and each of them are paid at a different rate by Medicare. If you understand those requirements and the rates that are there, then that can help you make sure that you're doing the things that you need to do to ensure the highest level of compensation from Medicare, and that same level of detail and care that you can provide for Medicare patients, you can provide for non-Medicare patients as long as you are up to date on the regulations for those payers. The 3 different types of visits are Medicare telehealth visits, virtual check-ins, and eVisits. 3 different types of telehealth visits that you can have. Again, each of them paid at a different rate with different requirements. We're going to take you through all of them. The first type is a Medicare telehealth visit. One thing that is important for you to note is that a telehealth visit for Medicare is the only type of visit that is available for a non-established patient. If there is a new patient that comes to your practice and you want to practice telemedicine with them, then and they're a Medicare patient, a telehealth visit is the only option that you have that you can utilize with a new patient. In order to qualify for submission, for claim submission to Medicare for a telehealth visit, you must use an interactive audio and video telecommunication system. It means that it has to see each other. The doctor and the patient must be interacting in real time, interactively, face to face. So we talked about that second bullet point. It is a real-time communication. That means that it's not the patient sending you a video or a picture or an email. This is a real-time, similar to a Skype or a FaceTime call. The following providers are authorized from Medicare to provide care via telehealth visits during the current national emergency. So if you are a physician, nurse practitioner, physician assistant, nurse midwife, certified nurse anesthetist, clinical psychologists, clinical social workers, registered dietitians, and nutrition professionals, all of you qualify to submit for reimbursement to Medicare for a Medicare telehealth visit. And we have the links that you can refer back to. We will, so if you wanted to check on this and get more information, the links are there below. The telehealth visits This is really interesting for a lot of practices. I don't think that a lot of people knew that during the current emergency, these visits are going to be considered the same as an in-person visit and will be paid at the same rate as a regular in-person visit. That's very good news for all of you who are looking to keep the revenue flowing in your practice. If you meet the requirements for a telehealth visit, that means that you can receive the same reimbursement as if the patient was sitting there in your office. That will be very helpful to your practices in keeping the doors open as we practice social distancing. Starting on March 6th of 2020, and for the duration of the public emergency, Medicare will be paying for these visits in all areas of the country. Previous to this, they had limited it to certain rural locations where there weren't enough providers of that specialty. So starting March 6th, and now as long as there is the national public health emergency, it doesn't matter where you are, you will qualify to be reimbursed for a Medicare telehealth visit. One very important thing to note, I have it highlighted down there at the bottom. The Medicare coinsurance and deductible would still generally apply to these services. That means that their coinsurance, or if at the beginning of the year, like we are now, haven't met their deductible, as a practice, if you want to continue to get paid, you need to be able to collect those things from the patients in as many circumstances as possible. We all understand that patients are going through economic distress that are out there right now, but in order for the system to function, there has to be a certain number of patients and a certain number of businesses that continue paying their bills. If that doesn't happen, then it won't be possible to continue providing care, because providing that care actually costs money. So make sure that you are collecting or giving your patients options to pay those either co-insurance amounts or deductibles over time through the different options that are available to you in your practices. Those do apply to the Medicare telehealth visits. And this keeps popping up and saying that we are at capacity. So again, I would ask if there's someone there that can figure that out. That would be wonderful, James or Richard. I'll move on to the next slide. So we talked there for a minute about the Medicare telehealth visits. Let's go through what is a virtual check-in. A virtual check-in is a brief communication service between practitioners and established patients, meaning not a new patient, via a number of communication technology modalities that include synchronous discussion over telephone or exchange of information through video or image. So that means that the patient can send over a video that they take of themselves or a picture of a condition that they have. And you'll be able to bill for a Medicare virtual check-in if you meet the requirements that we talk about here today. Medicare pays for these check-ins for patients to communicate with their doctors to try to avoid unnecessary trips to the doctor's office. Trying to keep everybody away from each other right now. So if you have patients that might have some conditions that are not as urgent, that don't warrant a full telehealth visit, you may want to encourage them to communicate with you via other methodologies, and you can still receive reimbursement from Medicare for that. So that will make that a little bit easier for you to triage the ones that are more in need of a real-time face-to-face video communication. You can bill for all of these services, and you are allowed to respond to the patient's concern by telephone or audio video, through secure text messaging, through email, or through a patient portal. So you use any of those things, you will be able to communicate and bill Medicare for a virtual check-in. One thing that I will pause and say here real quick is that if you are planning to use telemedicine, it is important that your EHR and the chart and the note for the patient reflect all of the different requirements that are included in order to verify that you've done what you need to do for that type of visit. So I'll share with you some of the codes that you can use to bill for these things in just a minute. But make sure that you are updating your charts and possibly your templates so that you're able to gather that information in order to meet the requirements that are here so that you can bill for it. With a virtual check-in, all standard Part B cost sharing applies. Virtual check-in services can only be reported when the billing practice has an established relationship with the patient. So again, no new patients. And another really important thing is that the individual services needs to be agreed to by the patient. So as you're deciding which patients that you want to see via virtual check-in versus a telehealth visit, you want to make sure that you have that noted that the patient agrees to it, have them virtually sign something or have them send you an email, put something in the chart that notes that the patient has agreed to it and that you ask them regarding those services. So what codes do you use? I'm not going to read these things to you. You can look up the codes yourselves, but the codes that you would use for a virtual check-in are two HIPAA codes. If you use G2012, that is used for live interactions on a virtual check-in. And if you use code G2010, if you're using the synchronous submission of pictures or videos, then that's the code that you would use to bill for the Medicare virtual check-in. Again, make sure that you're including all the documentation that is necessary to support that in the note in your EHR. So let's move on from the virtual check-ins to an eVisit. An eVisit is a little different than the telehealth visit that we talked about at the beginning, that it is only for established Medicare patients. They can, this is essentially a patient-initiated communication with the doctor without going to the office by using an online patient portal. The patient is the one that needs to initiate the inquiry. So you want to make sure that your patients know that they have this option, that you can utilize the portal in order to have this type of communication. The initial inquiry and the follow-up can occur over a 7-day period. That's very different than a 15-minute doctor's visit. So you have a 7-day period to have those interactions with the patient, and all of the services that you do during that period can be billed using the CPT codes listed on the screen, as well as the HIPAA codes listed on the screen as they're applicable. I have a little bit more detail on that in just a minute, so you don't need to hurry and write them down on this slide. There's a few more slides that go into more detail on that. The patient must verbally consent to receive virtual check-in services for that. So the patient needs to tell you verbally over the phone or over a video call that they consent to receive all of the virtual check-ins that we talked about before. Your Medicare coinsurance and deductible would apply to these services, and the Medicare Part B will also pay for eVisits or patient-initiated online evaluation and management conducted via a patient portal. So one of the big differences between an eVisit and a telehealth visit is the use of a portal being acquired on the eVisits. And the eVisit being something that is required to be patient-initiated, so the patient calling and saying, I have a problem. So if there's a routine care that you want to handle, that would be a telehealth visit, which is the first one that we talked about. If it's a patient-initiated situation where the patient's asking for the care, that's what an eVisit would be. We've got 3 CPT codes up there on the screen. The main difference between them is this last little section right here. The first one is for an eVisit that takes about 5 to 10 minutes in time. Then the next one's for 11 to 20 and for more than 21 minutes. So if you think about what your practice is going to need to do in order to bill those, you need to make sure that the interactions that you have with your patient include a start and a stop time in the note. If you have a start and stop time in the note, then that's going to allow you to prove that you spent 5 to 10 minutes doing that, or 11 to 20 minutes. If you really keep track of that and your interactions are taking 21 or more minutes, that means that you're going to be able to bill the 9924 or 423 for the higher number of minutes, which is also going to include a higher pay rate when that comes in. So tracking that and making sure that you can bill to the highest level possible is going to be critical to you in ensuring that you have the highest amount of revenue coming in as possible from the telehealth visits that you're doing with your particular patients. Another really interesting thing about eVisits is that clinicians who may not independently bill for evaluation and management visits can bill for a Medicare eVisit. So physical therapists, occupational therapists, speech language pathologists, clinical psychologists, if you fall within that group of providers, you can also bill for these eVisits to Medicare. You would use the codes that are listed up here on the screen. They're a little bit different because the other ones were for clinicians who do independently bill for evaluation and management visits. But if you're in the group that's up here right now, you'd use these G codes and you have the same minutes requirements that are there, 5 to 10, 11 to 20, or 21 and over. Again, please make sure that your EHR is updated and reflecting all of the work that you're doing so that you can match that up and bill to the highest level possible, maximizing your reimbursement. These services, again, we talked about that. They have to have the established relationship. Similar to the telehealth visit, it's no longer limited to just the rural settings. There used to be those restrictions for the e-visits, but no longer in place during the national emergency. Patients will communicate with their doctors without going to the office using the portals, must be initiated by the patient, and the co-insurance and deductible would generally apply to these services. The main exception to that would be if it's for the COVID-19, then most of those co-insurances and deductibles are being waived. But any other care that is there, the co-insurance and deductible has not been waived by Medicare for those. So that was a whole lot of information for you, and you wanted to take a snapshot of something. Here we have a slide that really concisely sums up what the services are, the different types of visits, the relationship that's required, and the codes that you would use to bill for those particular visits. We've included throughout the deck, and we'll provide for you a little bit later the links that we used to gather up this information. But again, we want to make sure that you understand that this is a lot more than just saying, I want my patients to start calling me on Skype. If you do this right, you can be reimbursed at very similar levels to what you had with your brick and mortar practice. So we talked a lot about Medicare. What about other payers? There's a lot of other payers that are out there. We said that they're a little bit different. I've included 4 of the national payers. It's important that you go look at the websites for each payer that you're in network with or that you might be billing for to see their individual requirements because they're different. I'll walk through the ones that are here so you can see how they're different. Aetna is requiring a $0 copay for all telemedicine visits until June 4th. So they're doing it for all telemedicine. Cigna is taking customers who are eligible for the virtual care not related to the COVID-19 and allowing them to utilize telemedicine through May 31st of 2020, but they said that out-of-pocket costs may apply. So that means if there's deductibles or co-insurance or co-pays with Cigna, there's still the possibility there that you're going to need to make sure you bill that to the patients. Anthem, I've taken the quote here right off of their website. They're providing a lot of their telehealth medicine through their Signacare mobile app, but they're also covering telehealth visits by phone with the primary care doctor in the plan until June 14th of 2020. And then last but not least on this slide, we've got United Healthcare, who for non-COVID-19 related telehealth visits, they are making all of the cost sharing and coverage that they will still apply if it's not related to coronavirus or COVID-19. But you'll be able to provide those services through United Healthcare through June 18th of 2020. All of these dates, all of these statements are up for change. The situation is fluid. As many of you know and have experienced, these providers or these payers may change something next week. It seems like every day is a year long right now, and the next day feels like you're in a totally different world. So make sure that you're staying up to date with the different websites and seeing what each of these payers are doing. regarding telemedicine. If you do that, I have confidence that we'll be able to keep the lights on with most of our practices, continue to provide outstanding patient care for our patients, and provide for all of the employees that work in our practices to keep everybody working. So it's also very important that you note that HIPAA has changed a little bit during social distancing. Effective immediately, the Health and Human Services Office of Civil Rights, they will exercise enforcement discretion and waive penalties for HIPAA violations against healthcare providers that serve patients in good faith through everyday communication technologies like FaceTime or Skype. So if you're trying to figure out how to get one going that's integrated with your EHR and practice management system, there's no reason that you can't, in the short term, start providing this care to your patient using the everyday communication technologies like FaceTime or Skype while you go and try to figure that out. So please don't wait until everything is in place to start providing care for your patients. Your patients need that care, and your businesses need those patients to receive that care. So HIPAA has changed, and keep an eye on the announcements from Health and Human Services to see as those deadlines either extend or pass, and as the rules change to make sure that you're staying in compliance with HIPAA during the COVID-19 emergency. So we've talked a lot about how you can provide care using telehealth medicine during the social distancing and national emergency that's out there. Now let's talk about how you can utilize Bill Flash and the options that are available to you through Bill Flash to help your patients pay you in a manner that respects social distancing. As we talked about, the deductibles and coinsurance still apply to telehealth visits for Medicare if it's not COVID-19. Another really important thing for you to understand is that while patients may be experiencing a lot of economic loss related to the emergency, a lot of them still have HSA and FSA cards and funds that are available for their healthcare needs. So there's no reason that you need to stop billing all patients. It's important that we have empathy and work with our patients to try to help them find ways to pay for the care that they need. And Bill Flash can help you do that, but recognize that in order for your practice to continue functioning, you have to continue getting paid. You need to get paid for the work that you do. What Bill Flash will allow you to do in supporting social distancing and supporting telehealth is we'll allow you to send those statements to patients without having to go to the post office, without having to get a bunch of stamps and envelopes and stuff them. You'll be able to submit your statements to the patients with the click of a mouse from your home or a click of a button on your keyboard, and they can receive those via email or through the mail, which is continuing to function during COVID-19. So nobody, whether it be your patients or your staff or you, will have to leave your home in order to not only send out the bills or provide care, but to receive the payment from those patients. Bill Flash is integrated into many different EHR and practice management software packages. On the phone, we have a number of different representations, and so the way that it's integrated is going to be different, but regardless of the system that you're using, we have something that can help you keep the lights on as you provide the telehealth visits for your patients. So how do we allow you to do that? Well, we have the ability to let you charge PreVisit Charges, which will email a charge to the patient and allow them to pay that online prior to a telehealth visit. Before Tucker was able to see his doctor via Skype, he had to make his payment for the copay, and we did that using an online system like Bill Flash. Post-visit electronic statement. So after you see the patient, if you remember the first type of visit for Medicare, you can charge just like a normal visit. So you'd send that to Medicare when the EOB came back. Then if they had a co-insurance or deductible, you'd send that back to them via statement. The patient can receive that statement via email, which means that nobody's having to interact with somebody else, practicing good social distancing. Payment plans are a really good feature to work with your patients as they experience some of the economic hardship of the coronavirus. What that allows you to do is set up automatic recurring billing starting on the date that you select with full PCI compliance. So that means that if you have a patient who lost their job and you wanted to do something like the mortgage industry did and say that their payments start on August 1st and they're going to be $50 a month for 5 months, you can set that up so that the first payment will not occur until August 1st. But when August 1st comes, you don't have to manually process it. It will automatically charge the credit card that you store. And then every month on the 1st, it's going to charge that same amount until the balance is paid off. Another feature that BillFlash has that can help you continue to keep the lights on through the emergency is automatic payments. What that does is it allows you to automatically charge the patient the amount of the statement up to an agreed upon amount. And I'll show you how this works in just a minute. So that means that instead of sending a statement out and waiting for the payment to come back in, as soon as the statement goes out, the payment comes in. And it goes right into your account. It does not go to a lockbox, does not go anywhere else. It's right into your account. It also allows you to store payment methods for these patients. So if a patient wants to store a credit card or a checking account on file, you can do that without having to worry about whether you're doing it in a PCI compliant manner. If you write it on sticky notes at home and just store it on your desk, that is not PCI compliant. There are a number of rules surrounding how you can process credit cards for people, and as you practice social distancing, as you provide telemedicine, you need to make sure that the collections that you're doing from patients, and maybe collections is the wrong word, but as you're enabling them to pay for the services, you need to do so in a PCI compliant manner, because that has not been suspended. So I'm not going to spend a whole lot of time on this slide, but I want you to understand all of the different things that BillFlash can do to be smarter and support social distancing. It allows you to mail out printed bills to patients that prefer to receive a paper statement without you or your staff having to go to the post office or procure paper or labels or stamps without having to have the mail carrier come into your house or your office and pick it up. It minimizes the number of touches that are there. eBill notices do the same, but the patient then can receive it simply via email. We talked about some of the other things that are on there right now, including the payments. So we have one place at BillFlash that will allow you to do all of those things and make it very easy for your patients to pay for the visits that you're doing via telehealth. So how does that work? Let's get out of PowerPoint world and into actual live software. I'm going to show you how this works from the perspective of a software called Metasoft. I'm not going to spend too many minutes in Metasoft because we're going to focus on the BillFlash interface itself. I want you to see how easy it is to integrate this with your practice management system. And as you see that, if you have questions regarding how it integrates with your system, please reach out to your value-added reseller or your partner, your software vendor. They'd be happy to show you how that works. So if I'm in Metasoft and I have my statements all aggregated and I need to send them up to BillFlash, it's as simple as a couple of clicks of some buttons, and those statements will automatically be uploaded from my practice management system up into BillFlash, where I, as a provider, have the ability to, if I had reviewed them in the practice management system, if I want, I can click approve and not have to do any of the steps that I'm about to show you. So understand that what I'm showing you right now under review is completely optional. If you've done the checking in the practice management system, you can click approve and be done with 2 clicks. It does not take any more time than sending it on paper. In fact, it's a whole lot faster. I'll show you why. When a lot of your practices will send statements out on paper, there's a number of different things that you do with them. You might print the stack out and go through it and pull statements out because it's the doctor's niece or the doctor's nephew that you don't want to send a statement to. You shred those statements. You might highlight things on a statement. You might write things on a statement. The whole purpose of that is to increase the likelihood that the patient is going to pay it by giving them more information. BillFlash supports all of the different methods that you use to do that on a patient statement right now that's printed out on paper. It does it in a much easier manner. If we click review, what you'll see is that all the statements that I just aggregated in my practice management system are uploaded here into the BillFlash approved files interface, where I can, if I'd like, I can click on the chart number and view the exact statement that the patient's going to be looking at. So if the patient has any questions about the statement, you have the ability to see exactly what they're looking at. And that makes phone inquiries a whole lot easier if you're all looking at the same thing. With many different practice management systems, that's a little bit harder because the EOBs from the insurance might come in, or different payments might come in, new visits might occur that change the balance, and the amounts due that you register in your practice management system might be a little bit different than what they're looking at on their statement. So as they're asking questions, being able to see that there over the phone and see exactly what they're looking at makes your ability to answer those questions a whole lot higher. If I wanted to, though, I talked about the ability to go and edit those statements. So that means delete them, change the color of them, write on them like you do with the statements right now. If I click that edit file button, it gives me a couple of really interesting options. If I wanted to add a message to the statements that are here, well, if I'm printing it on paper, I go write it on every single one or put a sticky note on every single one. If I want to add a message to those statements, though, I can highlight or click the ones that I want to add a message to, and then I can go add a message to the ones that I have selected. It's done instantly for all of the ones that you had checked. You can do a group message. You can also create a library of messages that are easy for you to reuse. So if you find yourself saying the same things to patients, apply the deductible, it's not covered by insurance, it was rejected, anything that you want to tell them on a regular basis that makes them more likely to pay their statement, you can create this library here that lets you select that, and then you don't have to write that on every single one. Some of the other things that you can do, you can delete them. That would be the same as pulling it out of the stack and shredding it. You can change the color of the statement from black to either blue, green, or red. A lot of providers like to use red because if the patient's not paying it, then that gives it a little bit more urgency and makes it more likely that they pay. We also allow you in mass to go change the methodology to either eBill or mail or both. So if you have patients or you want to send out both a paper statement that will show up in their mailbox as well as an eBill, then you can send both of those things very easily, and the interface here will allow you to do that. Anytime you change the methodology for a patient, it will be remembered, and the next time that patient receives a statement, that methodology will be defaulted over here. So if I wanted to add things on a one-by-one basis, if I come over here, I can go and add messages to one particular statement as well. I don't see that as being used quite as often because most of the time the statements have fairly similar notes or comments that you want to put on there to try to make sure that the patient pays them. So once we make sure that everything is good and we're ready to send that out, I can save the changes on that. It asks me to verify it. And then when I come back here to the Approved Files interface, all I need to do is click Approve and confirm that. And then what happens is that these 6 statements will be mailed out to those patients automatically the next business day. So think of all the things that you skipped, all of the social distancing that occurred as a result of that. You did not go get stamps. You did not get the paper. You did not get the envelope or the ink. You did not go to the post office, and your mail carrier did not have to come in. Yet you're still able to provide a statement that will show up in the patient's mailbox. All of those same benefits occur with the eBills, except the difference is there's no mail carrier to even touch the statement at all. So once those statements go out, then the whole point of this is to make it so that the patient has an easy way for you to be able to pay those statements. So let's talk about how the patients can pay those from within social distancing. If I come back here to the approved files, I want to come here for a second so that you can see I clicked the wrong button there, so let me go back to approve files one more time and review rather than approve. I want to show you a couple of things up here at the top of the statement. Whether the patient receives an electronic statement or a paper statement in the mail, they will have the ability to pay that online from the comfort of their home as they practice social distancing. You don't have to manage usernames and passwords for portals in order for patients to be able to take advantage of this. There's two numbers that appear on every single statement when you utilize Bill Flash with Bill Flash Pay services. The account number or chart number for the patient, and then something that's known as a form ID. If you have those two numbers and you point your patients to My Provider Link, I'm going to go here. I had it logged in. I want you to see the not logged in screen. So when the patient comes to My Provider Link, if you don't want to manage or deal with patients who forget their usernames and passwords, calling you and asking about it, there's an option here called Guest Pay. And you'll see if I hit Guest Pay, it's going to ask me for an account number and a form ID. These tie directly back to those numbers that I just showed you on the statement. So if they have those two numbers, then it'll bring them to the payment screen that I'm going to show you here in just a minute when I sign in on the with the interface, if the patient was utilizing the sign-in options with My Provider Link. But Guest Pay gives them the ability to pay their bills without ever even having to create that username and password. And everything that they need is on their statement, whether it's paper or electronic. Again, makes it very easy for them to do from the comfort of their homes. If they sign in, there's a number of different options that are there. This is my kid's computer, so my computer died in the middle of the apocalypse, so I had to switch over just a couple days ago. I apologize for that. My passwords are not saved, and the ones that we use for our demo purposes, but I have them here, and we'll sign in. When a patient utilizes My Provider Link and has an account and a login there, then when they log in, they're going to see their statements. If they receive an eBill, it'll bring them here, or they log in and they'll be able to see it right here. It'll give them the date that the statement was sent out. As you can see, this statement was just sent out a few minutes ago. I just submitted it for James Dugan when I approved that file a few minutes ago. If I click it, you'll notice that the patient will see exactly what I'm seeing. My Provider Link, if I didn't make it clear, this is the website that patients will go to in order to interface with your practice financially. They come here, this is what they're looking at. As you can see, it matches identically with what you were looking at on the Bill Flash page, which is where providers go. So if the patient has any questions, all of their notes and messages are going to appear here. The color is going to appear here, and all of the charges will show, and they'll have the ability to pay it. If the patient hopefully decides to pay it, they can click Pay, and then they have the ability to either pay the entire amount, a different amount. They can include a message that they send back to their provider. The patient can store payment methods on file that are PCI compliant and only link that patient to your practice, so it won't be at risk if it were to be taken. That's what PCI compliance is. We actually store a tokenized version of their number or their information, which means that only your practice as a vendor is allowed to charge that particular account using that token. That's what PCI compliance does for you. They can store that and then hit submit. And the payment amount was null. It gave me an error message because I didn't put in the amount right. So I had the other amount checked. I'm just going to put in a $100 payment so that you can see that that gives them that option. I click submit. It processes the payment, and the patient receives a receipt. So again, your practice doesn't have to print a receipt for it. It's all done automatically for them in the comfort of their home. If they want to print it, they can do so. The patient also has an entire history of not only their statements, but the payments that they make using Bill Flash. So if they have questions related to the payments that they've made to your practice over the course of the year, for example, for tax reasons, you can point them to their My Provider Link portal and they can get all of the information they need without you needing to run a report for them. My provider link in the Bill Flash payment services, we offer in-office payments as well that will make it so that all in-office payments would appear on this in addition to the online payments. So it's not like you would be sending them here for only their online payments and then have to print something out for the in-practice. When you utilize Bill Flash Pay services, they can do all of that regardless of whether it's in office once all of this craziness is over or online while they practice social distancing. Either way, they can get their report as it stands there. I want to show you, go back to Bill Flash a little bit and show you some of the other options. But first, actually, I want to show you how that comes back into a practice management system. I told you I wouldn't be in Medisoft for very long because I know a number of you aren't there. But in your practice management system, as you have integration with Bill Flash, you have the ability to then go fetch those payments and have them automatically populate into the system. My data is wrong on there, so it actually went over here to this one. Here you see the $100 payment for James Dugan that I just submitted is showing up in my practice management system. All I need to do is then go apply that to the charges. We talked about a couple of other options that Bill Flash can provide to you that will allow you to make it easier for your patients to pay. If we come back over here to Bill Flash and go to the My Payers tab, My Payers, when it comes to patient billing, are your patients. If you are a billing service, we support multiple sub-accounts or practices. So if you are from a billing service and want to see how this would work for you, if you had multiple practices that you did billing for, you'd see them all listed here. If you were a practice, you wouldn't have to ever even click this drop down. It would automatically be defaulted to your practice. I'm using the Happy Valley Medical Clinic, so I'll show you what that would look like. But here, you can see our patient, James Dugan. He has a stored pay that's pending. But we also have these two options here that we talked about a little bit earlier called Auto Pay and Plan Pay. So if we wanted to set James up so that as soon as his statement went out, all we would need to do is click Add. And what you'll see here is a couple of different very easy things to fill out. The maximum payment amount. So if you enter into an agreement with James that he agrees to automatically have his credit card charged for $50, up to $50 for all care at your practice, you would enter $50 here, and then you would either choose to enter that as a credit card, or if you wanted to do it from his checking account, you would choose that. Fill out the account number, or the account number here, the name and the routing number, submit that, and then as soon as the statement goes out, as we showed you earlier, it would be charged for $50 or up to $50. If the statement was for $100, then the patient would be automatically charged the $50 to the stored payment method on file, and then the other $50 would go on their statement, and that would either be on the next statement that went out, or you could collect that from them through your normal collection methodologies. If it's less than the amount that you've agreed upon, then it will just charge the amount of the statement. So it's very easy for you to set it up so that it's easy for those patients to make those payments the same way they pay for their electric bill or their car payment or their mortgage. Most of the younger people today like to have their bills paid automatically. Bill Flash allows you to support that with integration back into your practice management system, which then again allows you to receive those patients those payments from those patients for your telehealth visits while they're practicing social distancing. If we come back over here to My Payers and go back into James Dugan, I want to show you how to set up a plan payment. This is where we talked a little bit earlier about the options that were there. Say I was a brain surgeon and I had a very expensive bill, and James Dugan could pay $1,000 a month. I know that's a large amount, but if he was able to pay that over 10 months for his $10,000 bill, but you wanted to give him the option to wait out a little bit of the economic uncertainty. He might have gotten laid off, might have had his spouse get laid off. For whatever reason, you wanted to delay it. I could go down here and say, all right, August 1st, 2020 is going to be my first of 10 payments of $1,000. Here's the details on the notes. And then you have your card and checking account information that you can fill out. And then on the first of every month for 10 months, that amount is going to be deducted or charged from whichever methodology you enter here and automatically placed into your account. Again, the patient doesn't have to stand in your practice, swipe the card, do anything. It's very simple. And we integrate back into your practice management system so that it's ready in there for your staff to apply. We want to make it as easy as possible for patients to pay for their telehealth visits as you continue to provide those over the course of time. So let's go back to the PowerPoint presentation, and we can start wrapping this up and getting to some of the questions that are there. In summary, COVID-19 is affecting everybody. There's an impact to patient care, billing, and payment. If you understand the options that are available for you to provide telehealth to your patients, that means that you're going to be able to provide better care for your patients. It also means that you're going to be able to get better reimbursement for those telehealth visits. If you can remotely send mailed and eBill statements to your patients, then that allows you and your staff to practice appropriate social distancing without interacting with more people than is necessary in order to do the job. If you offer online payments to your patients, they're able to pay for everything that they're doing as you provide those services to them, even though they're not standing there ready to swipe their card or give you a check in your practice. And the payment plans and auto pays make it easier for those patients to make those payments and for you to set up arrangements that meet the economic needs of those patients as they go through the national emergency that's there. Another very important thing for all of you to recognize is that this is a group effort among all of us in the healthcare industry. It's not something where we believe that bill flash is the only thing that you're going to need in order to provide this care. There's a lot of different things that are necessary in order for us to be successful as we go about this. And I want you to take a look at this slide. There's numerous entities that are there in order to help you get this done. Your billing software company, whether I showed Metasoft, but like I said, there's a number of you out there with a lot of different systems. Make sure you're staying in touch with them and what they are doing to try to help you provide some of the services that we talked about today. Your value-added reseller, if you have one, is a critical, important cog in this machine. They specialize in gathering different solutions from the market and providing a comprehensive option for you that can help you handle all of the different things that you need in order to provide the remote services that your patients need. So please make sure that you're communicating regularly and listening to your value-added reseller as you go through and implement some of the things that we've talked about today. And then, of course, we believe that NextTrust and BillFlash offer you options that can help your patients and help you stay in touch financially with your patients so that you can keep the dollars flowing and keep the lights on as we all go through what is really new for all of us. So if you have any questions or you're interested in what you've seen today, if you'd like to see a demonstration that is specific to you or get a free remote billing and payment consultation, the contact information is up here on the screen right now. I should probably get back into the slideshow rather than showing it in the other thing, but I also want to point out that as you reach out to us, if you know who your value-added reseller is, it's very important that you let us know who that is. We want to make sure that we're working in conjunction with both your software vendor and your value-added reseller. So as you contact us, please make sure that you know who your value-added reseller is. If you don't know who that is, then we can help you find that out, and feel free to reach out. So with that said, I don't know if we ever got to the point where there were questions that were submitted. We can open up the phones, or not the phones necessarily, but the chat for questions. Mari, have there been questions that have been submitted over the course of the webinar? And if there have, then I'll have you answer them or ask them of me, and I can answer them. If you haven't asked a question, then please utilize the chat option on GoToMeetings live webinar and submit that, and we would be happy to answer any questions that you have. What we'll do is have Mari read those out to me, and then we can answer them. So Mari, are there any questions that are out there right now?
Yeah, Tony, we've had a really good amount of questions and comments. One thing I want to make sure, and you did touch on this, Tony, I want to make sure everybody knows that when we're talking about HHS and how they mention non-encrypted like Skype and those types of tools that you'd be able to use to telehealth, just keep in mind that that is not HIPAA compliant, but they are allowing that. Everybody should be more careful about just pushing emails. They're going to look like links and things like that. And mind that those are free services that are offered. Just keep in mind that they're not compliant and they're not regulated.
So I'm going to assume that it was not my phone that was cutting out there. I believe that it might have been Mari's. James or Richard, are you able to confirm that? If so, I want to make sure that I answer or say exactly what Mari said, but just to reiterate it because I think it's important. We did have the slide where we talked about the HIPAA changes. This is not an end of the regulation for HIPAA. Regarding FaceTime or Skype, what they're saying is that for the duration of the COVID-19 emergency, that they're not going to enforce that provision of HIPAA. But once this is over, it's still going to be in place. So I would recommend that you, if this is something that you're considering using, you utilize that as to bridge the gap as you figure out which telehealth platform you want to use that is HIPAA compliant on a go-forward basis once this is done, and especially keeping in mind the integration with your EHR and practice management system is going to be critical there. I believe that addresses what you were talking about, Mari.
Yes.
And Richard or James, can you confirm, is it my phone or is it Mari's, or do we need to switch up how we ask the questions?
Can you hear me now, Tony? Is my phone breaking up now?
That's way better.
Okay, perfect. So also there was a question about ABN and when that should be utilized. So if you're feeling as an office to use ABN, absolutely have the patient sign that. That protects you as well as lets the patient know and the insurance know everybody's on the same page. So if you're feeling the need to use ABN, by all means use ABN. We can't guide you what to do within your office and between you and the insurance, but I used to be a billing manager and an office manager, and I would definitely say this is not Nextra speaking, this is just me speaking, that if you feel the need to use ABN, by all means use ABN.
And Mari, would you just, for everybody on the phone, make sure that everyone understands the acronym that you just used? Could you just spell that out for them?
Sure. So ABN is an advanced beneficiary notice. And that is something that's between the doctor and the patient, and it's an agreement that if you're needing to collect money now for the services, but you're still going to bill the insurance, if the office gets paid by the insurance, then the monies would be returned back to the patient.
Okay. So make sure that you're utilizing those as necessary as you do the billing for your telehealth visit. Very good. Any other questions, Mari?
We did have a lot of questions about what codes to use. Tony, if you want to address that. I know that you addressed it earlier, but I'm wondering if people, you just might want to talk about coding.
All right. So this is probably going to be the most concise screen for coding. And we are recording this webinar, and we will provide a PDF of the slides to everybody who is on the call. But if you have questions about the coding, you want to make sure that you're working with your billing managers, talking to them. But generally speaking, these are the codes that you would use to bill for the actual visits. And then there may be other codes that you utilize in addition to these for the actual care that you're giving. So if you're doing the Medicare telehealth visits, then these would be the series of codes that you would use to bill for those, depending on your circumstances. If you're doing the virtual check-ins, these would be the HIPAA codes that you would use. And for eVisits, you would utilize either these three codes if you were in the first group, if you believe that was those that were able to bill for the evaluation and management visits, then you would use these 99 codes. And if you're not able to bill for those visits, you would use the G codes.
Correct. We've got a lot of questions that have just come in. One about eMid. Do you want to address that?
eMid is a product that we're working on at BillFlash. It is not one that is publicly available yet. We anticipate that it will be very shortly, but it's not one that I think that we're ready to talk about on this particular call.
Okay. And then someone had asked, Diana had asked about what is a VAR?
A VAR would be like a dealer or a vendor that you bought your software from that could also provide your support, your services. That very often practices will think of who do you call for support. Whoever you call for support is most often your VAR.
And then, let's see here. Okay, so any coding questions, you're really going to want to go back to your CPT code book or your HIPAA book.
Or there's also a number of different tools that most of your practice management systems have. So like I can, let me see if I can get out of here. In Metasoft, for example, if I come in here and I wanted to utilize the system that they have, I could go into my procedure code list, and you have the ability to go through and add CPT codes where there's a search. And I don't have that registered for this particular software package, but then there's an online search that will add that and give me all of the information that I need related to that code. There's things like codes on disk that's offered by Optum. There's a number of different online coding tools that you can utilize. And we are actually working on a series of webinars that focus on different tool sets. And I think that the online coding tools is one that we've had a lot of demand for. And I think that we're going to look at putting together a webinar similar to this one that focuses on the online coding as well. So look for more webinars to come out, but make sure that as you're getting coding advice, you're dealing with coding experts. And the other thing that I would just say that you make sure that you follow the rules around documentation. If it says that you need to interact with them for 21 minutes, you need to be able to show that you interacted with them for 21 minutes and what you were doing. So make sure that your note reflects that.
Okay, and then before we get to the last question, just a reminder that we are going to be sending out to all the attendees a copy of this webinar. That has been a question that's come up quite a bit. And the last question, Tony, will be if they do not have a cell phone or computer, can the provider do a phone call instead of a video call?
With some of them, the answer is yes. So if it's not the telehealth visit, but the eVisit, I believe, was the one where they could. Yes, it is the eVisit. So as you're looking at it, it needs to be an established patient. And you would want to do that as an eVisit, but there's probably going to be some limitations to what you can do for that eVisit, because some of them are going to require the virtual check-in, and you might need video or images. Again, you want to take a look at your specific specialty and the coding rules that are around your specialty and what level of care you need to give. Like if you're a dermatologist and you're evaluating moles without seeing a picture, that's going to be a problem. So I would say that phone calls are an option for certain types of visits, but it needs to be an established patient. If it's not an established patient, then the only option is a Medicare telehealth visit, and that is a real-time interaction that requires video. So for existing patients, you can do certain types of care via telephone. For new patients, you cannot.
Perfect. And then, Tony, just to end it with our 30-day free billing promo that we have going on right now.
Absolutely. I sort of missed on that one, which is not good. For all of you who are on the phone, Bill Flash is a great company. I've worked here for a year. I've worked with them for 10 years. We believe in our product so much. It is a month-to-month service, meaning you don't have to sign a year contract, a 2-year contract. If you use it for a month and you decide you don't like it, you can cancel it with no penalty. For right now, if this is something that you believe can help your practice remain viable, if you sign up during the month of March for your first 30 days or first month, we're going to allow you to send your mailed and eBill statements for free. Well, the only thing that we're going to ask you to pay is the postage on that, so 55 cents. And for the rest of the pricing after that 30-day period, I'd ask you to either reach out to the Bill Flash team at the number above, or you can reach out to your value-added reseller if you have questions about that, because it's going to depend on the suite of solutions that you decide to implement.
Perfect.
All right, so if that's the last question, Mari, thank you all for your time today. We appreciate it. Please be on the lookout for more webinars like this one. We're putting together a series of working from home and running your practice from home webinars that are designed to show you different options that are available to you and make this a little bit easier than it has been for most of us. This is a really interesting time in history, and if we can all get through it and provide the care that we need and provide the financial care that you need for your practices, then on the other side of things, it might be just a little bit brighter than it might appear right now. So thank you all. We hope that you all stay safe. Reach out if you have any questions, and we will talk to you all again very soon. Thank you very much. Have a wonderful day.